Voters approved it last November, expanding Medicaid for lower-income residents. But today, news that the program is delayed. Channel 8 Eyewitness News reporter Zach Worthington has more now in our top story this evening. Zach?
Yeah, that's right, Rod. We're talking about waiting until next October. Officials estimate about 94,000 Nebraskans would be eligible for the expanded health care coverage. Back in November, voters approved a ballot initiative to expand Medicaid coverage to all adults whose income is at or below 138% of the federal poverty line, or about $16,000 a year. Monday, April 1st was the deadline date for the Nebraska Department of Health and Human Services to submit their plan for expansion to the federal government.
We will be launching the Heritage Health Adult Program on October 1st, 2020.
The healthcare expansion is projected to cost upwards of $40 million a year. 90% of the cost will be covered by the federal government, while the state of Nebraska foots the bill for the last 10%. Governor Pete Ricketts has said in the past that this will put constraints on the state budget.
We're going to have to fit that within the budget. I've been very clear we're not going to raise taxes. The people in Nebraska are taxed too high already.
Ricketts has said that K-12 education, higher education, and property tax relief could be on the chopping block to make room. State Senator Adam Moorfeld is one of many who are unhappy with the start date of the benefits. He says it shouldn't take nearly 2 years to implement Medicaid expansion when 33 other states have done it much faster.
Louisiana took 6 months and Virginia took 8 months, and so there's no reason why it should take us almost 2 years to implement Medicaid expansion. I don't know what the governor's rationale is, but the bottom line is it's unacceptable.
Under the proposed plan, everyone will have to apply for health care benefits, and beginning on October 1st, 2020, they will kick in.
At the launch of the Heritage Health Adult Program, all members will receive basic coverage.
The state of Virginia implemented Medicaid expansion on January 1st of this year. DHHS officials say they are taking a close look at how the state rolled benefits out. They also say the delay in implementing the expanded health coverage is due to building a new system, and health services like these should be rolled out in a careful manner.
It is better for our fellow citizens that we carefully and methodically administer the expansion appropriately. The department is committed to ensuring Nebraska's Medicaid expansion is fully functional and viable on the first day of implementation.
Senator Moorfeld tells me that he and others in the state legislature plan on fighting this proposal. He says this isn't what Nebraskans had in mind when they approved the ballot initiative back in November.
All right, thank you, Zach. I know you'll keep us updated on